Hey everyone, welcome to this webinar. We're going to do a review of the AHCA Administrator Joint Training that I went to with Cheryl, and that's for 2015. Cheryl's on the line with us here,
Hello.
and Cheryl enjoyed the training a lot.
Yeah, because it was in the mall. That was about it.
Okay. And we had a nice long lunch break, and she got to go shopping. So it actually ended up being a more expensive training than it needed to be. The thing is, it's 6 hours, and we're not going to cover everything that was in the training because a lot of it was a review. Like the first 2 hours, they did a Medicaid, the managed care program review. They had was the morning also the
Ombudsman.
ombudsman?
Mm-hmm.
Ombudsman came up and talked about what the ombudsman does and how it works, that they have all these volunteers. And
It's
I
the
don't
same
think it
every
was
year. It's been the same
right.
every year.
Yeah, they have the Medicaid and then they have an ombudsman. Really nothing new, I would
Nope,
say.
nothing new.
And then we did lunch, so that was the first basically 4 hours, or 3 hours. And then after lunch, they start
The Department of Health.
the Department of Health. Department of Health went on for probably about an hour, hour and a half. I don't know.
They did a nursing home presentation to assisted living facility administrators.
Yeah,
So
they
we were
talked about
pretty
how
lost.
we should be charting our um, our infection control incidents and taking swabs of residents and random samples, and really a lot of it didn't apply to what we do. There were some things in there, and we're going to attach all the PDFs to all of the presentations in this on our page. I guess the biggest thing was about which infectious disease event is and must be reported to the Department of Health. And they had a list of things like scabies or I can't remember them all, but there were quite a few.
Solid pneumonia, all the ones.
So pneumonia that is
MRSA.
resistant to the specific, but
Antibiotic. It's not really assisted living stuff too much.
yeah, I mean, if the lab were to do a result and they said, hey, they have this infectious disease, for the most part, they're going to report it to the Department of Health. So I think the biggest was probably scabies. Anyway, so that was the Department of Health, and then they went
Scabies has
into
8 legs. They have 8 legs.
yeah, we
That's
learned
what I
that.
remember. We learned that. They don't fly, right?
Right.
They don't
They
fly.
don't. They can
They can
jump.
jump on you. So
And
gross.
only the female scabies crawl under your skin and
I
lay
don't like it when
eggs.
you even say the word. It
Okay.
creeps me out. Don't get itchy.
Yeah. I trying to think. Oh, they did do a portion of the training on the new online renewal. So you can, when your 2-year annual is coming up, you can do an online renewal, which you're going to get a postcard or a letter from AHCA saying that your renewal is coming up, and it gives you a deadline. And on that postcard, on that letter, it tells you you can renew online. And then if you go online, it's all really basic. It's super simple, self-explanatory. Upload your fire reports, upload your health inspection results, upload your liability insurance. Has there been a change in the ownership? Da 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 da. It was really, really simple. You upload an affidavit of compliance with the background screening, and then when you submit it, you pay your fee, and they take your money immediately. So just be aware, it comes out like in 10 seconds.
Before the application, right?
Yeah, and then they email you back if there's things missing, which we had. We had to update this or that, and then you resubmit it.
How about the health inspection? We weren't even due for it.
Right,
But we
but
had
they
to
wanted
get
it,
an
and
extra
the
one.
liability. The liability was going to expire in a month, but they wanted the new one.
Even though we weren't expired.
It wasn't expired, so just that. But we covered an hour of that in the training, and although it was good to know that there is online renewal,
they were thorough.
It's hard to learn that when you're just watching somebody point out some things on a screen versus actually going through it, and then the system will prompt you and say, hey, you didn't add this, or you need to do this. The system teaches you as you go through it. So the online, if you're at the renewal, to me, don't even waste your time with the paper version. Just do the online renewal. It saves us all a lot of time and energy. I'm going to pull up the screen. Oh boy, I don't have it here.
From the AHCA PowerPoint.
Mm-hmm.
Oh, it's all right. We can just talk about it. I have it here. I
Okay.
mean, all AHCA spoke about were the
Well,
most.
what do you see when do
Oh,
you?
I
You
looked.
know,
I clicked over to a different page, so
okay.
I see you.
Okay. Um, let me see if I can quickly do this to get it to work.
Another thing I liked about the training, Calais,
Yep.
was there was a Starbucks downstairs.
That was nice on breaks, wasn't it?
It was nice. It was just a long day. You
I'm
guys are
gonna just
lucky.
try
You
to
can
do
get
this
your.
entire screen. Let's see what you see here.
There's something happened.
Whoa.
It went
Okay.
dark.
What do you see now?
I see the leading age page where you have to click
Okay.
on it.
What do you see now?
I see it.
Okay, perfect. Okay, so this is the PowerPoint. Well, it's actually a PDF, and I just blew it up. So it's the 2015 Assisted Living Facility Joint Training. Let's just go through it here. It really shouldn't take that long. There wasn't much to it. Let's see. Okay. Then first they went through the top 10 deficiencies, which they always do. This was from the period of 2013.
I mean,
Yeah, the whole year.
the only thing different was that the year of 2013, the number one deficiency tag was under resident care and resident rights and facility procedures. So that
Yeah,
moved up to number one.
so they had, I think, training, right? Moved to number 1.
Training is number.
Right now it's number
No,
5. Can you see my screen?
no, I'm looking at my own screen. But
Okay.
in 2014, number one is staffing standards.
Right. I think they just wanted to highlight the changes. So they had number 1 was resident care rights, facility procedures. Number 2, staffing standards.
Which used
Number
to be,
3,
yeah.
medication assistance with self-administration. Number 4, resident care supervision. Number 5, training staff in service. Number 6, food service. You can see all of these here. And let's see what happens in
2014, they just kind of move around a
2014.
little bit. You know, staffing
Yeah,
standards become number one.
yep, that's right. Staffing standards moves from number 2 to number 1.
And
And then
training moves up
training moved
too.
up from 5 to. So really what that tells you is not that these people had all of these new mistakes. It's that the agency was focusing on these things a little bit more.
True, or just so many people had all these mistakes. I mean, training staff in service, there's no excuse. They can get their training on mylftraining.com, but obviously they don't know about us, or they are not, taking the proper training and keeping good records.
Right, right. Well, we offer
I mean,
most
those
of
are
it.
things
There
they
are
keep
some things
looking.
that,
Yeah, but like I know LMH and ECC, but there are some. I
oh
mean,
no,
they come and they audit.
I'm talking about like CPR and then the 4-hour medication training
Right?
and
Yeah. No,
first
I
aid,
know.
the things that we don't offer. But um, those are things that are preventable, the in-service training, and um,
Says
you
right
just
there,
don't hire
staffing
them. You
standards.
don't put them on the floor until they come in with most of their training. I know it's tough, but even though you have that 30-day grace period, if once you hire the employee, it's going to be that much harder to get them to do the things that you ask them to do. If you make it a requirement before they start, then it shouldn't be that hard. And especially if you can log into My ALF Training, if you have a subscription package, and you literally sit there in front of them when you're hiring them, and you're setting them up for their fingerprinting, and you're telling them they need to get a TB test, and you're doing these things. With our training subscription, you give them username and a password, and you tell them to go get all these certificates, and then I'll put you on the floor. And they're motivated, they'll get it done, and you'll be covered there. So staffing standards was number one. Do you think people just didn't have the proper staffing, of course, right? Or do you think they were
Right.
counting employees that they couldn't count?
Right. Well, hold on one second, because someone just got to the house. So let me mute this, and then you continue on.
Okay. Staffing standards, of course, we have to follow the staffing standards laid out in 58A. And a lot of people include personnel's hours in the staffing requirements that cannot be counted. And the only type of people that can be counted in the staffing standards are people that are actually providing care, or people like administrators who are helping to facilitate the care.
Right. I'm back, Clay. I
Okay.
think some of it with staffing standards too is and I hope you didn't already say this, but you know, if you have a resident that requires a lot of assistance, or several residents, and you only have, say, one caregiver, the minimum staffing, but they kind of inspect your facility and find out that you actually need to increase your staffing,
Right. Yeah, because
to meet those
there is an
needs.
asterisk. There is an asterisk in the staffing standards that says this is all great. Yeah, 0 to 5 residents is 168 hours. Um, 6 to whatever they are, 15, it's this many hours. But then at the bottom there's an asterisk, and it says that this is all dependent on the care that the resident needs. So you may have to have more. And then also if you have older residents, it does skew those numbers as well. You have to add for every number of residents over a certain age. So, but you're right. It really, it's, to me, it's counting people who shouldn't be counted, and it's having residents who require a lot of care. Like Cheryl, didn't we just have a situation where somebody asked us a question about a 3-person lift or assist or whatever?
Right.
Right. So if you have somebody that has a high level of care, you have to have that 24 hours a day just for the one person. So gotta be careful who you take in.
Right, and what kind of assistance they need, because you will have to increase that staff.
Right.
So if they find that you need 4 people overnight, you usually have one, you're going to have to put the 4 people in.
Right. Um, let's see here. Okay, and then they went into background screening.
Which hopefully everybody knows.
Right. I'm sure you've hired somebody, you had to put them through the background screening. Um, I really don't think there was anything new here that, I
There
mean,
wasn't.
is there something,
This was
something
just
about,
some fluff filling the air. There wasn't anything. It's just that, it's in a clearinghouse, so, you only have to get your prints redone every 5 years, rerun.
mhm.
And, just check your screenings periodically and make sure that you're running them, rerunning them, and that's on the screening to make sure they haven't had any disqualifying arrests.
Wasn't
Those
there
are things you
something
should
that
know.
you don't need to get fingerprints done again even if you've had a break in employment, as long as it's within the 5 years? I think there
Well,
was something to that.
you just go into the system and rerun them.
Rerun them. Right.
Yeah,
Right. You're actually running the FDLE.
it's like $12 or $16 or something.
Okay. And there were some questions in there about people being notified, because you will be notified, let's say, if one of your employees gets arrested and they have a non-qualifying arrest, meaning they can't work in a facility, you will be notified. You may be notified either way, and then you have to take the steps to remove them from work, put them in suspension or whatever it is. And then,
Well,
I'm
the
sorry.
way I got notified when one of our employees got arrested was the newspaper online. Her mugshot came up.
Oh, she didn't post something on Facebook?
Yeah, and then I went into Facebook and she was bragging about being arrested.
Right,
So
but that was before the level 2, the whole clearinghouse, right? That was like
it was
pre,
before.
yeah, right,
Yeah.
right.
I mean so it was just a different check, but So I think, this is better, I guess. We can get a notification it's going through this clearinghouse rather than finding out on Facebook or through the newspaper.
Hmm. Yeah. Um, I think I don't think that you'll be notified if they're taken off the list or if they're cleared or anything like that. I don't think it's that advanced. I think that somebody asked a question about that. But anyway, that was the extent of that. I don't think there was anything new there. Um, if you're not familiar how to do a background screening, then you can look in our videos. I think we have one, or we're going to put one up. But everybody should be pretty familiar with it. And it's pretty self-explanatory, isn't it, Cheryl? You
Oh, yeah, it's easy to do.
okay? Benefits of the clearinghouse. Um, oh, here. This is the retention of fingerprints enables the provider to be notified of an arrest. Da, 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 da. Then the second part says the retention of fingerprints will also provide a cost savings for those employees that are in the clearinghouse but have had a lapse of employment greater than 90 days. So that's if they've been gone for over 90 days, or if they worked at another facility and they were out of work for over 90 days, then after the 90 days you have to rerun it, pay the additional uh, currently
1475.
1475. Okay. Got to have your contractors in here as well, right?
Mm-hmm.
They were even saying volunteers, but
It was so vague.
I mean, I can't imagine getting every volunteer to get level 2 background screen. I guess it depends on how close they are to the residents as far as that's up to you. I'm not telling you what to do with it or without it, but
Mm-hmm. They may look.
they didn't come out and say. In fact, they made a point to say because one of the speakers said that you need to have your contractors and your volunteers and all your employees and everybody needed to go through here. And then one of the AHCA um, people shouted out that not all volunteers needed to be background cleared. So I don't know. I don't know. I mean, once again, they're trying to protect people, but then they end up hurting them because if you're going to make people get volunteers um, background screen every time, then it might be difficult. Um, it says, okay, so your employee roster, they showed you how it looks, but we've all done this. As you can see, it was a lot of us listening and them talking, and um,
Yeah, it's just a lot of review.
there's what the profile page looks like.
I mean, I think a lot of people think they're going to learn 6 hours of new updates, and actually, I
Hmm.
know other trainers they review the same thing and then they charge people $150, and you're thinking you're
Right.
getting this wonderful update of all this new information, but it's not. I mean, it's you
Well,
just
and to be honest with you, we're giving it away free if you are on the YouTube channel or Google Plus follower. But you can get credit for it by taking our ALF administrator update training. And it's not like we're going to give you 6 hours of this stuff or 10, 12 hours of this stuff. It's just a quick review, and then we'll go on to survey reviews and other important things. So there's the background screening website. Um, okay, and then they went into the online license renewal, which I told you about. It's only for renewals. Um, you can make your payments.
it is
Um,
fast.
yeah, it processes it pretty quickly, so 2 days or so. Um, so it's good for them. It's good for us. And like I said, you would have gotten a postcard, which we did. So we had done our online renewal before we even went. So it
Yeah,
was even more of
more
a
redundant.
drag during that presentation.
So like, I think this is the time I was like, hey, let's leave early. And you said, no, let's get our CV.
Cheryl's like the little devil on my shoulder there.
Like, let's go home. Let's get out of here.
Yeah. All right. That's all about the online. They're even putting online tutorial videos under development. Um, so maybe they'll let us put it on here. Or I'll just put it on. I'm sure they'll put it on their YouTube channel.
Right.
Okay, so the assisted living facility rule update highlights. All of this stuff here is just basically definition enhancements or changes. Like certified nursing assistant means a person certified under Part 2, Chapter 6. So they just defined it further. Direct care staff means, so I guess they had to add clarification to 58A and 429. They took out the term major incident because we used to call incidents that weren't adverse major incidents, but they're just incidents. So you just use your regular incident report. Or maybe, I don't know, what do they use the term major incident for? Do they use major for adverse? I
I
guess
think
that's what they're
so.
saying. They were calling them in the code major and adverse, but they both meant the same thing.
Same thing.
And I think that they're just consolidating it all to the term adverse incident. But a regular incident is an incident. Once again, they revised the terminology referring to mental illness to a mental disorder. They don't want to use illness word, so they changed to disorder. Staff in regular contact means staff in direct contact. Just really, this is what the update was in June or
Yeah.
whenever they put it out. This is the one teeny bit that came out of that whole thing,
Right.
which we were already aware of when they released it, but it's a good to point it out.
It's a good review.
Cheryl, go ahead. You want to take
Yeah,
this?
I mean, they just changed the rule and they wanted to make sure that you understand under the 58I-5.0181, they clarify that a resident with a stage 2 pressure sore may be admitted in a standard licensed facility if the resident receives services from a contracted home health agency or a nurse. And of course, you need to document that, and it still needs to improve in 30 days. It can't get worse. Go to a stage 3 or 4 while they're at your place. But so instead of just having a 1 or none, you can take in someone with a stage 2, and then they can get treatment from hospice, a home health agency. The family can contract with a nurse in a standard license.
Yep. So if you're visiting somebody at a rehab and they want to discharge with a level 2, you don't have to have them wait anymore or say no to the admission. But just line up something and document that, have that nurse document someplace where you can get a copy of it, or you can, or meet with the nurse. Tell them that, hey, you're admitting, this home health company comes to take care of this pressure sore. Meet with the nurse ahead of time and say, listen, I need to document that this is getting better or improving, or I need to know what is happening with it. So every time that you come to visit them, don't just come in and leave without telling me or reporting the progress of it. And then I would just keep that in their observation or in their records somewhere. And if it gets to the point where it's gone, then definitely have that documented.
Exactly.
Okay. Assisted living facility rule update highlights, second page, resident who otherwise meets the admission criteria for residency in a standard license facility but who requires assistance with administration and regulation of portable oxygen, routine colostomy care, or assistance and monitoring of the application of anti-embolism stockings as provided by a healthcare provider in accordance with the manufacturer's guidance may be admitted to a facility with a standard license as long as the following conditions are met. The facility must have a nurse on staff or under contract to provide assistance or to provide training to the resident to perform these functions. Second, the nursing staff may not provide training to unlicensed personnel to perform skilled nursing services and may not delegate the nursing services described in this section to CNAs or unlicensed personnel. So basically, the nurse has to do it,
Right.
or the nurse can train the resident to do it. But what would you say to that, Cheryl? The resident would have to be capable of.
Of course, capable. It's probably not as likely as the nurse doing it themselves. So they're kind of like loosening up on standard license, that have nurses working there and let them perform things under the scope of their license.
Mm-hmm. So, I mean, okay, it says the nurse on staff or under contract to provide the assistance or to provide training to the resident to perform these functions. So, well, let me ask you a question. Somebody has TEDHOs or whatever, right? And the family contracts with a nurse to come in, or we have a nurse contracted with us, and then can the family pay the nurse to do the training and then the nurse leaves? I mean, they're technically
Not sure.
trained.
I thought this was overseeing, like the nurse could oversee them. It's all up for interpretation. They're gonna,
Yeah, I mean, well,
you make
that's the
sure
way
the
I read
residents
it.
can do it, or the nurse is doing it, basically. Otherwise, they're gonna come and start digging and looking around.
Sure, yeah.
They're not gonna accept that.
Yeah.
So
Well, I
that's
guess if
just
you have
the
the nurse
changes for the
come,
nurse.
if you have the nurse come once a month and make sure that they're still able to do it,
Sure.
that's still training and some oversight. That's
Sure.
not my advice. I was just asking you what you thought. Yeah. All right. Next, continued residency specifies that the interdisciplinary care plan must delineate the services which will be provided by either the facility or hospice staff. A hospice resident may only receive services from the ALF staff that is within the scope of the facility's license and nursing services within the scope of their professional license. So I think this is a clarification. Would you say, is this a clarification?
Yeah.
To say you
It's
need
a
an
highlight.
interdisciplinary care plan.
Right.
The care plan has to say who does what.
Service. Who does what, and you should have that at all times. They'll
And
ask for
then
that when they come.
they will, yeah.
Who's on hospice? I would like to see a copy of the interdisciplinary care plan. I have made copies of all of ours and made sure they're in the resident file and in the hospice book since we're up for inspection. So,
Well, we do that anyway, but we
yeah,
make
but
sure.
I mean, I really made sure everything was updated in there.
And then so this is something that I know a lot of nurses who run facilities, they may provide nursing services, but the way that this reads here is that you can provide nursing services up to whatever your license is in an ALF with a standard license as long as they're under hospice. That's the way I interpret it. I know there's a lot of nurses who it is hard to determine, but that's basically what it says, is if you have a resident and they're under hospice, you can provide nursing services up to your license.
Correct.
Your personal, like your nursing license. Okay. Okay. An individual admitted to and receiving hospice services may be admitted to an ALF as long as the individual otherwise meets residents' admission criteria. And I think the point of that was to say, because they get a lot of questions saying, can I take somebody in who's on hospice?
Right.
And they're saying, of course they can.
Of course.
As long as they meet the other admission criteria. They can't be bedbound, those type of things.
Right.
So you can take people in on hospice. Medication practices. Clarifying the assistance with administration does not include. I mean, a lot of simple stuff here. Just clarifications, corrected rules, citing references. Okay. Corrected rules, number 7E, corrected rules citing references and clarified that faxed or electronic copies of records or orders are acceptable. A nurse may take a medication order by telephone. Such order must be promptly documented in the resident's medication observation record. The facility must obtain a written medication order from the healthcare provider within 10 working days. A faxed or electronic copy of a signed order is acceptable.
Yeah, those are hard to get afterwards too. So, but you can do it. Just keep in
Okay.
mind.
So do you think that would cover a home health nurse taking a phone order? I mean,
Yeah, I don't see why not. But
yeah,
you're as a facility, you're going to want something written.
right. Yeah.
I mean, it's and following up and make sure this. A lot of our home health companies are pretty good. They
Yeah,
follow up
in
with
this
us, and
situation, let's say a
they need
home
that
health
paperwork
provider,
too.
they do. Let's say a home health provider's there and they say, "Hey, Mrs. Johnson's blood pressure is really high." They call the doctor. The doctor says, "Hey, let's change the metoprolol to double." And then the nurse takes the order, makes the change. Um, I personally would type up a letter, you know, stating the change, fax it to the doctor's office, and then follow up as well because you can't assume that that nurse is going to do it for you. You have to go and do it and be persistent because you only have 10 days. And I think, didn't we get tagged one time for having an order that was like 10 or 12 days?
Mm,
Didn't
no,
they?
because we don't take phone orders.
No, no,
No, no, I don't think we did.
we didn't. Okay.
I
I
think
must,
I
maybe
think
we
we
did.
got. I think they didn't get the order, and it was this big issue. But we had documented it properly of how all the
I
steps of
think
how we
that's what it
tried.
was. The
We
family came
tried. We
with the
family
medication that
call
was
like
filled
from
by the
Walgreens or something or
pharmacy, but we
CVS.
could not get an order. Walgreens wouldn't give us the order. And that's another reason why we don't like using those type of things, Walgreens, and because they just, well, I'm not going to give you the order. That's a violation of their HIPAA.
I
It's
know,
like
and they act like we just magically prescribed these drugs ourselves and went and filled them.
there was a doctor's
There was
order,
a
obviously.
doctor. Yeah, there's a pill bottle that has all the information on it.
When we first started, I think we said, well, the pharmacy has it.
The pharmacy has it. Call Walgreens.
Yeah,
But it's true.
I
They don't
know.
want to give it to us, so call Walgreens. They have it.
Yep.
But we've gotten a lot better in the last 6 years.
Okay. They clarified for do not resuscitate orders. They just changed like the location of where you can get the DNR. And then this is one. There must be documentation in the residence record indicating whether a DH form 1896, which is the do not resuscitate order, has been executed. If a DNR has been executed, a yellow copy of that document must be made a part of the resident's record. If the assisted living facility does not receive a copy of the resident's executed DNR form, the assisted living facility must document the resident's record that it has requested a copy. So when you're admitting them, you have to say, do you have a DNR? You do. Can I have a copy? Okay, I'll make note of it that they do have a DNR. And our admission form, um, there's a little spot that says, does this resident have a DNR? And we either write yes or no. So if you write yes and they don't have one, you say, I'm waiting for write a note, waiting for the family to bring one.
Right. And then follow up too. You can't just do
Right,
it one time. You'll have to
right.
follow up with why you don't have it, a week later. What's going on? Beginning,
Yeah,
middle, end.
it has to be like the staff. Actually, that's the next one. Executed DH Form 1896 must be readily available to medical staff in the event of an emergency. So when all of our files, we have our files stored in our locked cabinet, and then our medication files for the residents are separated. And the medication MORs, in there we have a little emergency to go pack, and it has like the 1823. It has if there's a DNRO, it has if there's a living will, a power of attorney, and then the face sheet. And so when people go to the hospital, we keep a copy of the DNR and all that stuff in their files, but we have to go make a new emergency pack. So every now and then you have to have all your staff go through and make sure that they have all of those things updated in there. Is there DNR in there? Is there face sheet 1823? So that would suffice the rule that it must be readily available to medical staff in the event of an emergency, and then a copy of it in their resident records. So, okay. Staffing standards. Okay, initiative to ease burdensome regulation, understanding that specifically for smaller facilities, the death of the administrator is an extenuating circumstance. It permits the agency to temporarily approve management of a facility by an individual who is 21, has a high school diploma or a GED, has completed background screening, but has not completed core training and testing, so long as such individual completes the necessary training and testing requirements to become an administrator within 90 days. That
Which
doesn't make
makes
any
sense.
sense to me. Isn't that the same thing?
It's the same thing. Yeah. I mean, I guess, if there's like death of the administrator or some kind of a big circumstance.
Hmm. I
I
thought
mean,
that's
you
the
have
way it
3 months
was.
anyways. You have 90
Right.
days anyways.
But I think
But
it lets them go
they're
past
clarifying
it.
it.
It lets them go past it. I don't know.
Yeah.
No, it says
No, because
become within 90 days. That's right.
right, same rules. They're just
Okay.
clarifying it.
I guess
Yeah,
so.
they're just.
Staffing standards. Um, the rule now requires that staff having or suspected of having a communicable disease must obtain a statement from a healthcare provider indicating that there are no longer a transmission risk rather than permitting the administrator to determine that such condition no longer exists. So I guess in the code somewhere it said that
We have to determine it as administrators, but now they're making it a little more clinical.
they
So,
want something
yeah,
signed by the healthcare provider.
right, which makes sense.
Okay.
Because really, how do I know if you're clear or not?
Right, that seems a little weird to have an administrator say,
Yeah,
"Yep,
some of the
fine."
rules do need to be revised.
Conditional license, I think conditional license may be issued to an applicant for license renewal if the applicant fails to meet all standards and requirements for licensure. So I think this is the renewal. Um, okay, the can't exceed 6 months. I think the point was for a renewal. Yeah, license renewal. So if, for example, you submit on time and you're still waiting for all your paperwork, they can issue us a conditional license to exceed up to 6 months, determined by the agency to allow you to get all that stuff together to renew. Conditional license process. Um, so it's just how you do it, basically. Contact person. This is a good contact person. Catherine Ann Avery, and her email is catherine.avery@ahca.myflorida.com. We've emailed her questions. She's really good about getting back to us on any issue. So
She's
I'd
really
plug that in.
nice.
Yeah, I'd
Yeah,
plug that into your email if you ever have any questions.
especially medication, because she's a nurse and she's run all of that.
Right, right. Don't email her your gripes or anything like that, because I'm telling you, it's
Well, if you do, don't tell them you got our
yeah.
email from us.
Just tell them.
Go ahead, email her gripes.
Just the clarification emails are good,
Yeah,
I think, because she can't change things, and the
no.
way that you and I think it should be, I mean, that's not the way it is sometimes.
Right. A lot of
So,
times the rules are being made by people who aren't on the front lines like we are working, and we understand. So hopefully
um,
they will get changed.
extended congregate care, created to promote aging in place, promotes resident choice. This is just a review. Um, independence in decision making requires specific policies and procedures. Requires a health assessment update annually. That's some of the differences. Also, how often do you get inspected with an ECC license, Cheryl?
Every 6 months.
No, no, no.
No, every 4 months. Quarterly, right?
That was every 3 months,
Every 3 months.
quarterly.
Sorry, LNS is every 6 months.
LNS, every 3 months.
No, thank you.
So, aging in place, I mean, you can do a lot of aging in place under hospice. So, um, requires additional initial and ongoing training for supervisor and additional training for staff. Requires updated service plans, assessments, and documentation. And there's the quarterly visits by AHCA. Some same admission criteria, but may be bedridden for up to 14 days. So that you can't take people in that you couldn't take in with a standard license. Um, you must have service plans, progress notes, and nursing assessments. Limited nursing services requires nursing assessments, nursing notes, documentation for all residents receiving limited nursing services. Um, so that's just a piece of paper in their file. A facility must employ or contract with a nurse, so they don't have to work for you, but you have to contract with one. And then they get monitored every 6 months. A lot of fluff review stuff.
Right.
Facility must maintain a list of residents receiving LNS services. LNS licensure allows residents to receive a variety of nursing services not permitted under a standard license. Limited mental health. Cheryl, you want to read any of this?
You usually sound so good.
Okay.
You want
Licensure is
me to?
required for Oh,
You
let's
want to
touch on
break?
this. Licensure is required for ALFs with more than 2 mental health residents, right? Um, how do you determine who's a mental health resident, Cheryl?
Well, they come with paperwork from Department of Children's and Family or from a case manager.
Right, or they're
So
receiving some sort of SSI
it's
or
called a
disability.
community living support plan.
Right,
So, and you do have 30 days after admission to get it, but they, they'll have a care man. Someone will help place them, and you'll know that they have that support plan coming.
right. So that's what the 2 or more mental health residents would be, those that have that disability SSI payments from the government, OSS. Um, so 2 or more, you need a limited mental health license. Limited mental health license doesn't cost any money, but it does require additional training for the administrator and the staff. The facility must have a cooperative agreement with a mental health provider. A community living support plan must be in place between the resident um, facility and the provider. The facility must assist the resident in carrying out the activities support plan. We're wrapping up here, guys, but it's not going to be much longer. Specialty licenses. Facility is required to observe resident behavior and report concerns to the case manager. Ensure the resident and case manager have the opportunity for face-to-face contact. Ensure that staff have completed the required training. Adverse incidents. Every facility is required to maintain adverse incident reports. Yeah, we know that. We know about adverse incidents. Resident elopement. If the elopement places the resident at risk of harm or injury,
Right.
in an event that is reported to law enforcement or its personnel for investigation. So this is good review. You guys can print this PDF or look at it. 1 business day, 15 days. Got to be done online. Everybody knows that. They used to be able to do paper or fax. These are the number of incidents. So there were total of 275 in 2014, 234 reported to law, 2 ended up in brain spinal damage, 40 deaths. So how to prevent adverse incidents, assessment for continued residency, staff training, elopement drills, staffing levels, directed plans of correction. They're used to address Class 1s and Class 2s, which require immediate action. They help to improve service and assist providers with attaining compliance. So AHCA basically helps you to correct this. They give you a corrective plan of action. It's not the only thing that they do or the only thing that they expect. Intended to oppose directed interventions to address immediate concerns with identified deficient practice. Provider must still complete and implement a plan of correction. So Class 1, they explain how the process hand-delivered. You're required to sign it. At Class 2, facility receive a letter within 10 days outlining the facility, what they need to do. and to address the deficient practice. And that was it.
That was it.
That's all you got
And it
out of
was
it.
free for you guys.
Let me
We
tell you
paid.
something. It it was worth the time to go, but it wasn't worth the money. That's what I would
Oh,
have
it
to
was
say.
$280 for two of us to go.
It wasn't worth the money. It was worth the time. It's always good to be
Yeah, it's
there
always good to
and
get
to
training, but we'll just
you
update them
never
for you guys every year.
you don't know what you get out of it. You know what I mean? Um, we met some good people, but $280 and the whole day wiped out was
It was
a little
tough.
too much for me. I feel like they go out of their way to not cover controversial subjects or it. I mean, too very little questions and answers, just a little bit. And then at the same time, to be honest, people are afraid, I think, to speak their mind because you have all these AHCA surveyors there, and they're afraid to ask, questions and say things because they might be getting a, you know,
Well, we're up
uh,
for inspection.
yeah, we
We don't
didn't raise
want to
our hands
raise
or
our
say
hand.
anything.
No.
So, well, that's it, guys. I hope you liked this update. Please subscribe to our YouTube channel, follow us on Google Plus, um, or take any of our training online, and you'll join our mailing list. Okay? Thank you, Cheryl.
Goodbye.